Hello and welcome. Thank you very much for registering for this webinar about family building through egg donation and surrogacy. Today we have Dr. Falk, who is Medical Director at Utah Fertility Center. Hello, Dr. Falk.
Hello.
We also have Tonya Kennedy, who is the Program Director at Utah Fertility Center. Hello, Tonya.
Hello.
And we also have Angela Goodell, who is former gestational carrier with Utah Fertility Center. Hello, Angela.
Hi.
Thanks everyone for joining us. We're going to start this webinar with Dr. Falk, who is going to cover the medical aspects of the journey. So Dr. Falk, when you're ready, thank you.
All right, well, thank you, Juan. I appreciate the opportunity to present this because I think it is one of the most important things in family building that we can provide to help couples. First, by way of introduction, I'd like to tell you who I am. I'm the medical director of the Utah Fertility Center. I've been in practice for nearly 30 years, and I've been involved in international third-party reproduction for the past 25 years, helping many thousands of couples from all over the world, Asia, Europe, and the Americas, achieve their dreams of becoming parents and having a family. So right now we're going to focus on the Utah Fertility Center. The Utah Fertility Center is located in the Intermountain West. So that's between the Sierra and the Rocky Mountains. And so it's based in Salt Lake City, the largest city in the state of Utah, but it also has offices throughout the Intermountain West in Las Vegas and up into Idaho. It is involved in treating many couples along the United States, from New York City to California to Hawaii, but has recently expanded to the world where we're treating patients from all over the world. It's called the International Service now because we're helping many couples from Australia, from Europe, from China, Japan, Korea. Many different couples are coming in to help find a way to achieve a successful pregnancy. In today's webinar, we'd like to go through the steps involved and introduce some of the key players that will help you to achieve parenthood. The members that we have on the team are myself as a reproductive endocrinologist. I'm board certified in both obstetrics, gynecology, and reproductive endocrinology, which is the field of infertility. I'm also boarded as a high complexity lab director for all of the embryology side. We also have Tonya Kennedy, who is in charge of our egg donor and surrogacy program. She helps coordinate all the international travels and programming of getting third-party members involved in this family building. Beyond our individual clinic, we also use gestational carrier agencies because one of the rate limiting steps to achieving success is finding a good gestational carrier. We work with dozens of agencies that help us find the ideal candidate for our patients. And then to make sure that the legal aspects are navigated appropriately, we have an international USA attorney, as well as work with a local attorney in the country that we're working in. And the two of them will work together to ensure that once the baby has come to the world, has been born, then we can enable that child to go home with their parents. So the type of patients that we serve are diverse. We help couples that are trying to have a baby that may not be able to because of some tragedy of losing their uterus, for example, or having cancer where they have no more sperm or no more eggs. So we'll help traditional couples that need in vitro fertilization, gestational carriers, and egg donation. But we also help single females who may not have a partner or a sperm source to enable them to have a baby. And so we might find them donor sperm for inseminations or help them through in vitro fertilization. Similarly, we help single males who do not have an egg source. So we help them find an egg donor and a gestational carrier to build their family. We also help same-sex female couples where, similar to a single female, they may not have a sperm source, so we find donor sperm and enable them to go through with inseminations or in vitro fertilization. And same-sex male couples that may not have an egg or a uterus to help them achieve a successful outcome, and we enable that. The most important equation in reproduction is on the bottom of this slide, which shows that you must have a healthy egg, a healthy sperm, and a healthy uterus to achieve a healthy baby. So our goal is to find those first three variables, bring them together for our patients, and achieve a baby and build a family for them. It's a very complex process, as you can imagine. But to make it easier, I broke it down into steps of that path to parenthood. So the first step for most couples or individuals is to choose a fertility clinic. So you want to find a clinic that you're comfortable with, that's affordable, that's capable, and has top success rates to enable you to achieve success. Then once you're with a physician, then you create a plan. So if it's a same-sex male couple, for example, then we find an egg donor, we go through the process of in vitro fertilization, or if it's a same-sex female couple, find donor sperm. They might need genetic testing, pre-implantation genetic testing, then find a gestational carrier and then bring it all the way to when you bring the baby home. Choosing an egg donor or a sperm donor usually requires help. And so that's where Tanya will talk a little bit about that later on in terms of finding the ideal candidate that could be your sperm or egg donor. Then we complete our testing. We get sperm shipped to the Utah Fertility Center where we can then go through in vitro fertilization, creating blastocysts, which is the embryo stage at which it implants. At that stage, we typically will do genetic testing to make sure that the embryo is as healthy as it can be, and we can choose the very best embryo to put back into the uterus. The next phase is to choose a gestational carrier. This could take some time because you have to develop a relationship with that individual. But we'll work with agencies or we have gestational carriers ourselves that will help you find the perfect person that can help you create that baby. With the gestational carrier, we'll have you meet with an attorney, both local and in the United States, to create a contract so you both understand exactly how the process will unfold over those 9 months of pregnancy. And then we have the gestational carrier come to Utah Fertility Center where we do the embryo transfer. The wonderful news is the vast majority of people are successful through these treatments. And so once they become pregnant, they'll carry the pregnancy and create the baby and eventually carry the baby home and celebrate in the process. The steps involved for each of these components are listed here, where the physician is in charge of helping choose the fertility clinic, create the plan and go through all those multiple steps. But then we have our program director, Tanya, who will help choose the egg donor and then go through the steps that follow. The surrogate or gestational carrier will be involved later once we have the embryo available, and that will be towards the last half or the second phase of the treatment, as will the agency and the attorney. I did want to talk briefly about COVID and how this has impacted international reproductive medicine. The biggest impact has been on travel restrictions. Fortunately, the COVID virus is a very low morbidity virus, but it's very infectious. It's similar to the cold virus that we have in our nasal cavities often. Fortunately, it doesn't affect pregnancy adversely on all the studies that we've done to date. So we're not worried so much about the medical risk, but it has created a large barrier to treatments just because of the travel restrictions over the last year and a half. To help with this, we've established relationships with multiple centers around the world where we can have our couples go to those centers, for example, and collect sperm and go through specific testing that ensures that we can use those gametes, the sperm or the eggs, through the in vitro fertilization process. And then we have them shipped to the United States at the Utah Fertility Center where we can then create the blastocysts and help our couples continue with their treatment. So in Europe, we have over 10 clinics now that we work with that can help us by shipping the sperm to us. And the good news is we live in one of the most beautiful areas of the world. In the Utah Fertility Center, we're at the base of this beautiful mountain. And we have clean air, clean water, and beautiful people that really are genuinely nice and very helpful to help you achieve a family. But we also have a large center in Las Vegas where a lot of our intended parents fly into and enjoy a nice vacation while they're going through the treatments as well. So lots of opportunities for you. And I look forward to to helping you in the future in any way we can, because our ultimate goal is the creation of a family and to have a healthy baby. So to that end, I'm going to introduce Tanya to you, and she will carry it through the choosing of an egg donor. So Tanya, take it away.
Hello, thank you, Dr. Folk. So I want to talk to you about the complexity and help you through what Utah Fertility Center can do to get you an egg donor and a gestational carrier. Let me share my screen so I can share my slides. So egg donation. For egg donation, we have one of the largest donor databases in the United States. We have over 300 egg donors that have already had medical screening done, psychological screening, drug screening. Every single donor that's put on our database, we feel like has a really good opportunity to get you a healthy baby. As you can see, we have some very beautiful girls. This is just a few of them on our database. You can have your situation as a known situation or an anonymous situation. Known can mean a few different things. So known can mean that once the child becomes an adult, the child can then reach out to someone within the egg donor's family to find out about their genetics. Or it can be anonymous, where no one ever is clear on whose genetics are whose. Either way is fine. Everyone's journey is a little bit different, but you get to choose that according to which lady you choose on our database. On the database, when you're looking at it, you'll find out a lot of information about the egg donors. Some of that information is their height, their weight. Is their hair curly, straight? Are they right-handed, left-handed? What did they do when they went to school? Did they go to college? Do they have a master's degree? Are they strong in math? Are they a strong singer? And also you'll get to find out their family medical history, things like how tall is their mom? How tall is their great-grandmother? How was their medical history in their family? Was there anyone in their family that had heart disease or diabetes or some sort of genetic disorder? So you find out a lot of information. We're here to help you with that as well. We know all of the donors on our databases personally, so we can help you with that. You can say, I want somebody who's got a really good sense of humor, and we can guide you to somebody with a really good sense of humor, or somebody who's really brilliant, or someone who plays an instrument. We can help guide you to that person. One other piece that you can do here in the United States is called Pgta or Pgtm. This is a genetic testing of the actual embryo. So with this testing, you can actually choose the gender of your embryo. So maybe the first baby doesn't matter, but the second baby does. And so you would want to be able to choose which embryo you're either putting in your uterus or in your gestational carrier's uterus. Also, you can choose an embryo that's chromosomally normal. So that is huge when you can choose which embryo is going to set you up with the highest chances of pregnancy and the least chance of miscarriage, giving you the highest chance of a healthy baby. Now, when it comes time to meet with your surrogate, once we find out that you have met with a surrogate and you would like to match with her to move forward, the first thing we do when we get the information is we go through her medical records. We're looking to see if there's any major complications in her past pregnancies. We want to make sure that she was a healthy woman who was able to have a successful pregnancy and delivery. We then set up an interview with her. What we're doing with the interview is we want to make sure that her medical history looks good and her social history looks good. So basically, what medications does she currently take? Has she had any recent medical conditions? How much alcohol does she drink? Has she ever used nicotine products in the past or currently? And what is her current relationship status? Is she married, single? What is it about her current situation that makes it the perfect time or not the perfect time to be a surrogate? We're also looking for any kind of past concerns. For instance, in a prior pregnancy, did she have severe nausea and need an IV? Was there any kinds of issues in her pregnancy or any kind of issues in her prior medical history that could cause a problem with your pregnancy? Then, if your carrier lives outside of Utah, we're going to bring her to Utah for a medical screening appointment. That medical screening appointment includes a head-to-toe physical exam. We're looking for overall general health and also looking for any kind of high-risk behaviors. Like, does she have marks on her arm where maybe she did IV drugs, or does she have any kind of indication that there's physical abuse in her household? Is she physically weight-wise and overall with medically with the practitioner looking at her, is she overall healthy enough to carry a successful pregnancy? That practitioner is then going to go through her medical history with her again. They're going to perform something called a water ultrasound or a saline sonohystogram, where we actually assess the interior of the uterine cavity to make sure there's nothing abnormal going on in there, so that we can hopefully make sure that you don't have a miscarriage and that an embryo has the highest likelihood of implantation. We're also going to do pre-pregnancy blood draw and urine sample to check for hormones, infectious diseases, and drug screen as well. After she comes here, it usually takes about 7 to 14 days for us to give her full medical clearance. Once we give full medical clearance, then we pass to psychological for them to give the carrier psychological clearance, and legal, so that we can make sure that your contracts are all done and all of the attorneys feel like we're ready to move forward. Once we have medical, psychological, and legal clearance, then we can create a color-coded calendar that sets up all of her appointments, all of her medications, so it's very clear what she needs to do next. She will then set up her appointments. We'll teach her how to do her medications, when she starts things, when she stops medications, how to do those scary injections that she'll have to do in her hip. Once the transfer takes place, we'll let you know. And then once the pregnancy test comes, we'll all celebrate together. So that's basically the process. It's very complex, but you're not doing it alone. We do this often, every day. This is our everyday job. And so we will hold you by the hand and walk you through the entire process. I would like to now introduce a really special team member at Utah Fertility Center. She is a former surrogate that I think you're going to find as really amazing and has some great things to say about the process. Angela?
Hi, my name is Angela Goodell, and I was a gestational carrier. I decided to become a gestational carrier because I was inspired by another carrier and her story. Every relationship between intended parents and the gestational carrier is different, and I chose to have a close relationship with the intended parents throughout my journey, and it has been one of the biggest life-changing experiences for me. To be a part of anything or something that allows parents to become parents is really extraordinary. And since this was such a big life-changing experience for me, here's a little video that shows detail on my personal experience as a carrier.
Okay, so now we come back on, right? Because this is going to be edited anyway. So I'm not gonna pause the recording or anything like that, right? And then I'm going to say the goodbye, the thank you and the goodbye, okay? And then we can all say goodbye, okay? I'm just gonna wait 2 seconds.
And Tanya, I think we can cut out that delay of you bringing up the screen.
Yes, Yeah,
That
it
was-
always,
It kept turning black. It worked a second ago.
I know it
worst.
did. Okay. Okay, well, thank you very much, everyone, for your participation, for joining us. We hope it was helpful for your family building journey. Thank you very much, Dr. Falk, Tonya, Angela. Thank you.
Thank you,
All right,
Juan.
well, thanks to everybody, and be sure to reach out if you have any questions. We'll be happy to help you on your journey.
Yes, and you'll find our contact details in the screen very shortly. Thank you very much, everyone. Bye-bye now. Thank you.
Thank you. Bye-bye.